Thank you very much. I want to thank my predecessors up here, John Sarbanes, for beating me by 5% when I ran for Congress against him, so I don't have to spend all my hours of every day raising money. And to Seema for talking about what my theme of my talk is going to be about, place matters. So I met Corey, who's a real young man who could have been a story in the wire. Back in 2002, he was 14 years old. He was the head of the McKean Avenue Boys. Anybody know where McKean Avenue is? I'm not allowed to ask questions. Raise your hand if you do. Probably no one does. It's a tiny little street in West Baltimore that had the top of McKean Avenue Boys as a drug gang and the bottom of McKean Avenue Boys as a drug gang. Parenthetically, that's part of the reason that we have such a large drug violence problem in Baltimore. We're a city of neighborhoods, as you all know, which is a great thing, but it also allows for a lot more overlapping drug turf, which leads to more drug violence. So Corey met me back in 2002, having been arrested 14 times by age 14 for drug possession, drug distribution, and gun charges. He lived with his maternal grandma, who was a substance user of some significance, his little half-brother, who was 7 years old. His dad was in jail in South Carolina due to drug distribution charges. His mom was dead due to AIDS related to substance abuse as well. And he lived in a row house in West Baltimore with no electricity, no heat, and no food in the little refrigerator that they had jerry-rigged a cord from the next door row house to. He came to us in a program called Operation Safe Kids, which we launched back in 2002 in response to then Mayor O'Malley's request to take a look at the juvenile homicides that had occurred the previous year, when we ranked #1 in the country for juvenile homicides, with 32 young people between 12 and 17 killed in Baltimore in 2001. So we looked at that, the reasons for that, and there were basically, it was probably, you could guess at what they were, but in the 4 of them were girls who were accidental victims because their boyfriends were involved in the drug trade, and the other 28 were all gunshot victims to the head and torso, large bore weapons within 2 feet or so of their body. They were assassinations due to the gun trade. So we started a project called Operation Save Kids to try and keep the next 32 kids in the city from being shot and killed. And we did it in 2 ways. We had a program called KidStat, where we brought up every young person who was referred to us by the police in a meeting with a bunch of decision makers, folks who didn't have to go through the bureaucracy to get the kid what that person needed. We had the head of the public defender's office who defended these kids. We had the head of the state's attorney's office who prosecuted these kids. We had juvenile services, we had housing, we had education, et cetera, et cetera. So Corey was our very first case, and he came to our attention in November of 2002. We went over the case in this KidStat meeting, which we held sacrosanct at 10 o'clock every Tuesday morning in the health department. And first things first, we had to get him food and electricity, so we got the housing department to immediately do that, and emergency assistance. We wanted to get grandma into drug treatment so he could live in a more healthful environment, but grandma refused to go to drug treatment. Anyone know why? Raise your hand if you think you know why. No one knows why? Because Department of Social Services, she was afraid, would take away the kinship care money that was coming with taking care of Corey and his half-brother. But we worked with DSS, who was with us in the KidStat meeting, and assured the grandma that she would keep the funding if she went into treatment. We had our treatment provider system there at the table as well. We got her into treatment. And meanwhile, his paternal grandparents, who had never met his maternal grandma, lived on the east side of town. As you know, Baltimore is a very divided city along Charles Street. And they agreed to take in maternal grandma, who they had never met because Corey's mom and dad had only met once, if grandma got clean. And they were very working class folks, very solid citizens, if you will, without being too pejorative. And they agreed to take Corey in. So bottom line, within 2 months, Corey had been moved to a different school. By the way, he had been truant 90% of the time at his previous school when he was in West Baltimore, because he was on the corners all the time. He'd given up his pager, which just before cell phones came into ubiquitousness, pagers were obviously the way of getting information across. He had been now attending school 95% of the time at the new school, was living with his paternal grandparents in a very safe and decent neighborhood. And maternal grandma got clean in residential treatment and then was in outpatient treatment and was staying clean. Success. But then in February of 2003, I had a police pager from the police commissioner at the time, Eddie Norris, who actually has a part in The Wire, actually an extensive part in The Wire. And he had given me this pager as sort of an odd perquisite of the job. And it went off on, I think on Valentine's Day or right around then, and there was a homicide on the west side of town. And at that time we had very few kids on the west side of town, and a 14-year-old homicide victim and on the west side would be tragic, but it would be one of ours. And it turned out, however, it was Corey. He had gone back to the west side for his little 7-year-old half-brother's birthday party and was shot and killed by a 13-year-old who had had a former beef with Corey from his back in McKean Avenue days. So we went to the funeral. I've been to a lot of funerals. When I was the health commissioner, AIDS epidemic was taking off, and so I went to a lot of funerals of all sorts of different cultures and diversity, examples of diversity. So I've been to a lot of funerals, but I've never been to one like that before or since. And I'm going to tell you a little bit about it, and then I'll move into the place matters. So we go to a row house in West Baltimore, and Corey is laid out, looks like he's a little guy, 14-year-old, and obviously the gunshot was to the back, so it was not a headshot, and so they had him as he was. No one was there looking at Corey. They were milling about in the main area of the two row houses that had been put together, with most of the young people there wearing T-shirts that said R.I.P. Corey, and then his birth date and his death date. And it struck me at that time, this is like 2 days after he'd been shot, that there was actually a market for these things, that there were enough homicides of young people, not just juveniles, but young adults as well. As you know, probably 15 to 24-year-olds in Baltimore, by far the leading cause of death is homicide. So there's actually a market for making these RIP shirts out there. In the back were 3 trench coat wearing young men, actually boys, who clearly were packing. Grandma was out, unfortunately, maternal grandma was out drinking in the front porch, front stoops. And then the pastor got up to say, basically, we've got to stop this killing. We've got to, no more tit for tat, et cetera, et cetera. And then I will never forget this. Corey's father came up and said, if I had ever met my son, this is what I would have said. So I'll close the story with the follow-up. Unfortunately, Corey's 16-year-old cousin did not follow what the pastor said, and he and his running mate tracked down the 13-year-old after the 13-year-old had been picked up by the police but released on bail, of a teeny little bail. And this 13-year-old was killed by Corey's 16-year-old cousin. And then the 16-year-old cousin and his running mate were shot. One died, one didn't, by the previous kid, the 13-year-old kid's running mates as well. So what are the lessons to be learned without getting you too down? I can tell you that Operation Save Kids, as far as I know, because I'm not in the same position as I was then, has had, that Corey was literally the very first kid, and I don't believe of any of the several hundred kids that have since been taken into the program and case managed in the neighborhoods by people who are from the neighborhoods, making sure that the kids are getting to work or school or athletic activities, have been shot or killed since. So it's a good news about that. But it also goes to show that no matter, even with immense resources being brought to bear, and we're talking about resources in terms of time and money and high-level bureaucrats, if you will, the chaotic lives that so many of the kids lead in this city lend themselves to tragedy, even with an immense amount of resources coming in. So that gets to the point that I really want to make, and that is that place matters. And Seema was talking about that in terms of some of the data, and I can tell you, some of you have heard about the other Westmore. It's a book about 2 Westmores from Baltimore, one who grew up in a somewhat different environment than the other, and had very different outcomes. But it just struck me that if Corey, who was a brilliant kid, I met him, and the fact that he was 14 years old and running a drug gang, and a successful one at that, unfortunately, had he been brought up in a Roland Park or an Ashburton, would most likely have had a very, very different outcome. Got me to thinking about what are the attributes of a successful community, a place to raise kids and adults in a successful way. And that's why I have my prop. It's the four-legged stool of successful communities. And I would venture to say that they are the following. One, decent, safe neighborhoods with housing that is safe to live in. So it's not lead poisons, not mold, and that it's a safe neighborhood. Second, solid public education system, particularly having solid public schools in your neighborhood. Third, access to healthy foods and physical activity and health care. And fourth, and probably most important, is easy accessibility to livable wage jobs, not minimum wage jobs, for the adults in the community. If you have all four legs of that stool, you're going to be much more likely to have a stable community than if you just have one or two of them. A couple quick examples. Not to rain on anybody's parade, and I have great respect for Mayor Smoke, who first appointed me back when I was a young fellow. But Sandtown Winchester, anybody know Sandtown Winchester? Well, Sandtown Winchester was an attempted holistic approach to improving a neighborhood in West Baltimore that pretty much had decent success in improving housing, their Nehemiah housing. If you drive along Fulton Avenue or some parts of just south of North Avenue, you'll see it. But it didn't really address, to a great extent, the school system, the schools in the area, a little bit on health, but not much on livable wages. And 10, 15, 20 years later, there's the same level of poverty, albeit with nicer housing. But it doesn't make for a very successful community in general. I don't want to be totally stereotypical. Similarly, we had a project in Howard County where I was a health officer for a little while that dealt with providing health care to those who were working class, who didn't have health insurance through their jobs and made too much for Medicaid. So folks said, why don't you bring that to Baltimore? And the reason it wouldn't work is because just providing like West Baltimore or East Baltimore with decent health care is obviously a good thing, but the community is not going to be successful without a decent education system, without good housing, and without livable wages of jobs available in those neighborhoods. So I argue that we need to do a lot more to get to this four-legged stool. And the mission statement, or the assignment for all of you, is to do a couple of things. One, fill in the incredibly thin bench we have in Baltimore City political life so that we can get new council people, new legislators, new mayors who have a real passion for improving the city. I would argue that that's not very prevalent right now. And second is force our politicians, our leaders, to put the emphasis on improving lives in the city rather than on things like the Grand Prix. This is probably the biggest bugaboo. If the mayor and the council and big business people put the amount of resources and time and effort into trying to bring livable wage jobs, grocery stores, other decent health care, safe schools, and safe neighborhoods to the neighborhoods of Baltimore, we'd be in much better shape than the guaranteed money loss of the Grand Prix, which, by the way, doesn't serve very many people from Baltimore City. I don't know very many Baltimore City residents that have gone to the Grand Prix. So I give you that mission statement, that assignment. So for the young people in here, we need a much stronger bench in Baltimore politics. And everybody in here needs to work to try and improve and get to the safe communities that we would have if we have a true four-legged stool throughout the entire part of Baltimore City. Thank you very much.